स्टार्ट हो गई।
So today's topic is about suture materials. In case of suture materials, there are three topics. First is characteristics of suture material. The material which we are using, which should be ideal, which should be close to ideal. Second is the material itself. Second is the material itself. And third topic will be on suture pattern. Suture pattern. Once we apply the pattern, then we close the suture with something we call knot. And after this, there will be removal of the suture. So in this topic, the suture material, in ICAR exam, they have asked most of the MCQ from the material itself, like ICAR 2018, suture pattern 2021 ICAR net exam. And from the note in some PSC exam they have asked, and from the suture removal there was one MCQ in ICAR 2019. So this suture material topic is very important for the MCQ point of view. The first topic is the characteristic of suture. As we know, there is nothing like ideal. All the suture materials they have their own properties and they have their own characteristics. If we start with the first property or the first character, that is the size of the suture material. These sizes are given by different standard government committees. This is your United States Pharmaco. According to this pharmacopoeia, the size which is given in your surgery book is smallest to largest. What is smallest? 12 0. They say that 12 0 is the smallest size and number 7 is the largest size. The meaning of the 12 0 or 7 is itself creative. If you make 0 like this, 12 0 means there are 12 times 0, 10, 11 0, 10, 10 zeros, or we simply write them 10 0. Similarly, we have 5 0, 4 0, 1 2 3 4 5, 4 0 1 2 3 4. More the number of zeros you add, you will make your material clear. If you start removing these zeros, then you will come at the end. Suppose you have 2 0, then 0. This 0 is called as 1 0. So as we go from more zeros to less zero, what we are doing, we are increasing diameter. Means this fiber is thin and here you will get thick fiber. So from this concept that the size of the suture material, there was one MCQ in 2021 net exam. That question was that 1 0 0 1 2 0 and 2. Which of the following suture material is having largest diameter? This was the MCQ. So as per the size, 1 0 means there is angle 0, 1 means 1, 2 0 means there are 2 0, 2 2. So if we arrange these size, there 2 0, then 1 0, then 1 and then 2 is the largest diameter fiber. So this was the MCQ. And which is the largest available suture. So number 2. So more zeros means the fiber is full. If you decrease the zero, you are going towards the more thicker. So what we are studying this size, the clinical application of this size is very important. So where zero, that is the smallest fiber, that is the thinnest fiber, and here is the number 7. That is your thickest fiber. This is the thickness. Number 7. Yes, here. Hello.
फिर से बोल, थोड़ी कटा है साउंड.
अभी क्लियर है? नहीं. अभी क्लियर है? नहीं
ऐसी आ रही है.
कौन है?
बोल.
हेलो.
हाँ हाँ. नहीं, वैसी आ रही सेम.
कम है?
कम नहीं है, बीच बीच में शायद नेटवर्क के कारण खराब हो रही है.
शायद.
है
हाँ, क्लियर है ना?
अब.
So first characteristic in suture material was size. This size varies from thin to thick. They say 12-0 is the thinnest one or number 7 is the thickest one. This is smallest or thinnest. This size is as per the United States Pharmacopoeia, and this number 7 is largest. As size increases, strength increases. Means this is the thin fiber and this is the thick fiber. If we look at the size means that is diameter. If we look at the size of the thin fiber, smallest fiber, and the thickest fiber. So as the size increases from 12-0 to 11-0, 10-0, like to 7, the strength will increases. Why it is important that size increases, strength increases? The concept is size must match with the strength. Size of the suture, it must match with the strength of the tissue. It means, suppose there is one tissue, if you are doing some surgeries in the eye, for example, you are doing cherry eye operation. In that, normally we use 50 suture material, normally. But if you use number 5, means there is mismatch between size and the tissue. If there is mismatch between the size and the tissue, then what will happen? The normally eye is a soft and delicate structure. We should use 50, but if you use 5 number in the eye, what will happen? It will cut through the eye soft tissues. That may lead to non-closure, that may lead to infection, or that may lead to tissue strangulation or delayed healing of the eye, or it may lead to the non-closure. So there are these are the complications if you do not match size of your suture with the tissue. Another example is, for example, rumen. We usually we normally close this rumen with number 5. In case of 5, if you use the undersize, if you use undersize means suppose you are using 20, then what will happen? This rumen structure needed the size of the 5 catgut and you are using 20. It means these are the two edges where you want to oppose, but you are using undersized suture material, that is 20. So what will happen? Your strength of your suture material this time is less. So there will be poor apposition. There will be poor apposition of these two edges of rumen. The second complication will be non-closure. And if you by chance, if you close this rumen, then what will happen? There may be dehiscence of the suture material, dehiscence of this wound. It will open. It will open. So there are many complications if you do not match size of your suture material with the tissue. So the first characteristic was size. The size is available as per the US Pharmacopoeia. In different book, this size may vary, but in a small animal surgery book, it is given 12-0 is the smallest size and 7 is the largest size. Size increases, strength increases. Okay. If you use oversize or if you use undersize suture material, then the complications may be non-closure or poor apposition of the wound edges, or there may be chances of infection, or there may be chances of cut through. It may cut the tissue. If you use oversize means you are doing ophthalmic surgery like cherry eye, and instead of using 50, you are using number 4. Undersize means you are closing a rumen, you are closing a uterus or any big structure, and instead of using that 5 number, you are using 10. So this size should match with the tissue. So size, as the size increases, the strength of the tissue material also increases. Means 7 number size suture material is more stronger than your 12-0. So an oversize and undersize, they have on its complications. So from the size, one MCQ was asked, that was your 10, 20, 1 and 2. Second characteristic of your suture material, that is absorbability. Means there are some places where you want absorbable suture. Inside the body, there are some places where you want non-absorbable. Which are the places you want absorbable suture material? For example, subcutaneous, muscles, peritoneum. These are the places we want some absorbable suture, like your internal organs. Which are the places where you want non-absorbable suture material? Obviously, best example is skin. So, as per the concept of absorbability, suture may be absorbable or suture may be non-absorbable. As per the definitions, absorbable means which are absorbed within 60 days. They are known as absorbable suture. If your material take more than 60 days, it is called non-absorbable suture. Then in case of absorbable sutures, there are two types. One is your natural and second is your synthetic. The mechanism of absorption for these two is different. They are absorbed inside the body by phagocytosis, or we can call them enzymatic degradation. This is the main mechanism of absorption of natural suture material. For synthetic, there is only one mechanism, that is hydrolysis. But these non-absorbable suture materials, they are not absorbed by any mechanism, not by phagocytosis, not by hydrolysis. These are removed by us. We remove skin sutures in 10 to 14 days. So, absorbable suture materials, they may be natural, synthetic. Mechanism of absorption, degradation, breakdown inside the body, phagocytosis mainly. For synthetic, hydrolysis mainly. But for non-absorbable, these are removed by doctors. These are removed by us. For example, skin sutures we remove after 10 to 14 days. So what is this hydrolysis and what is phagocytosis? Hydrolysis means there is one mechanism, hydrolysis. Hydrolysis means breakdown by water. This is the suture material. This water molecule break down the covalent bonds inside the material. So this is the hydrolysis. Second is enzymatic digestion or phagocytosis. There are neutrophils, there are macrophages. For these cells, suture materials are foreign body. So these cells, they phagocytize or enzymatically degrade the suture material. So the second characteristic is absorbability. The suture material may be absorbable and it may be non-absorbable. It depends on the place where we are using. We use non-absorbable mostly for the skin and absorbable for the internal organs. That may be your peritoneum, muscles, subcutaneous tissues. And absorbable, they are absorbed, they are eliminated, they are breakdown within 60 days, and these are more than 60 days. The third characteristic is the tensile strength. This is the tensile strength. Tensile strength means ability to resist breakage. Ability to resist breakage or stretching. This is the fiber. This is the fiber. If you stretch from suppose A end or B end, if you stretch this fiber from both the ends, it will break down. But the point initially, suppose this is nylon, this is vicryl or any catgut. If we compare tensile strength of two suture material, one is vicryl and one is your catgut. Okay. Suppose this is AB, these are the 2 points of your vicryl and these are the 2 points of your catgut. If you start pulling like this, at one point it will break. So if you compare the two suture material, which will break easily on stretching, because when we place the sutures inside any tissue, then at the end we apply knots and we pull the suture material to apply the knots. So while pulling out of these, which suture material break down easily? The answer is catgut. It means tensile strength of catgut is less than the vicryl. So if you pull the vicryl or if you pull the catgut, which suture will break down easily? Answer will be catgut. So the tensile strength of catgut is less than the vicryl. So vicryl has more tensile strength than the catgut. Similarly, there is one term we called functional strength. This is nothing but the tensile strength in vivo. In vivo means inside the tissues, inside the body, and that is outside the body. If you are pulling outside, it is called tensile strength, and if the same thing, if you have applied your suture material on linea alba, suppose you are doing OHE or you close the linea alba, then because of the gravity, because of the weight of the intestine and other organs on that material, it starts pulling. So because of that pulling, that catgut will break down. And the owners, they come with the complaint that suture material opened, it dehisces and the abdominal viscera comes out. So it is advisable use that material which is having good tensile strength. If you are doing linea alba approach for your OHG, the suture material at the linea alba, they should be good tensile strength. Otherwise, if you apply a fiber which gets breakdown, then all the content will come out. That may be the case of wound dehiscence, that may be the case of evisceration. So that is the common problem with the mismatch of the suture material, or if you use a material of less tensile strength. So it happens with the OHG or pyometra cases where they come with the problem of breakdown of sutures. Or suppose you are doing a hygroma cases, there is one best example. In case of canine, there are hygroma. Suppose this is the body of the your canine, and this is the point which keep on coming in contact with the ground. Because of continuous friction, they develop hygroma. They develop hygroma, which is nothing but a non-inflammatory swelling. If you surgically operate this hygroma, and if you apply some suture material over this operated hygroma, after 2-3 days, if the animal is doing small activities or keeping this elbow on the ground or doing some frictions, then this suture material may get open. So this is the best example where usually suture materials get open, because at this point the tension is high. These edges, they keep on pulling the suture material in different directions. So it is better to use at this point that material which resist the breakage. So hygroma is the best example where continuous activity may lead to opening of the suture material. Then next is your structure. Suture materials, they may have structure like monofilament or they may be multifilament. Multifilament. Monofilament means the suture material is like this. Only one strand. And in multifilament, there may be multiple thousand of strands. Maybe thousand. These are the multifilament. Monofilament, only one strand. Multifilament, these strands, they may be arranged like this. Like this. We call it braided. We call it braided. Or they may be simply twisted on each other. They may be simply twisted. So in case of structure, monofilament example is your nylon. Mostly we use nylon on skin closure, and that is your monofilament. For multifilament, there is one we call braided. Braided means the girls, when they are going in schools like 6th, 7th, 8th class, they braided their hairs like this. The example for this braided one is your vicryl. Vicryl suture material is multifilament and braided. And the second is your twisted. Again it is multifilament, but all are twisted. The example is your catgut. So catgut is an example of, so these are the three suture material which are used in every college, OPD, clinics. Commonly they are used: nylon, vicryl and catgut. Nylon is monofilament, but there are some product of nylon which are available in multifilament format also. But the commonly used is monofilament, that we close the skin. Second is multifilament, that may be braided like this. All the fibers are crossing each other and maybe simply twisted on each other. The braided one is your vicryl and twisted one is your chromic catgut. So these are the three suture material we are using: monofilament, braided multifilament, twisted multifilament. Why to study the structure of suture material? There is one next characteristic which is called capillary action. Capillary action means suppose this is the fluid inside the bladder, and it is having bacteria. There is rupture of bladder and you have option to apply monofilament or multifilament. You have two options in your hand. Your bladder is ruptured and you have two options: what to apply, mono or multifilament. If you look at the structure, suppose you have applied here multifilament. See, the structure of multifilament is like this. In case of multifilament, these spaces are called crevices. These are cracks. These are micro spaces. If you apply onto the bladder like this, then in these crevices, From the infected urine, suppose there is bacteria. These bacteria, they may enter these crevices and they may come out. And these bacteria, if they come out in the peritoneal cavity, they may cause peritonitis. Peritonitis. So the structure itself define that capillary action means this is a bucket filled with water, or suppose this is a bucket filled with urine, urine plus bacteria. If you put monofilament or if you put multifilament suture material in this bucket, and if we compare in which material there will be capillary action. So in case of multifilament, the bacteria will find some spaces and they will come to the other cavity. So in case of multifilament, chances of contamination will be more. Bacteria will enter and there will be capillary action. So what is the example? Example is your catgut. Catgut is the suture material which is multifilament twisted, and in between these twists there are spaces. In these spaces bacteria will enter. And catgut, the disadvantage of catgut is more capillary action. More capillary action means fluids and bacteria, they will enter into the catgut. So if you want to remember one example for the capillary action, this is the catgut. And this is the disadvantage because the suture material what we are using, it should be non-capillary in action, means if you compare, multifilament have more capillary action than monofilament. It means your catgut is having more capillary action than your nylon. The next characteristic of the suture material is this is the memory. Memory means return to original shape. This is the packet of the nylon. And this material is like this. If you open the nylon material packet and if you bring your suture material outside, and this is like this, if you make your suture material straight, then after leaving it on the table, it will again become like this. It means the nylon material has a property, inherent property, to come back to its original shape. So this is the inherent property of these materials, where if we open the packet and we straight the suture material, suppose this is inside the packet and this is the nylon. You open and you make the straight and you apply your needle. Then this part of the suture material, again it will become like this. This is known as memory. There are some suture material which is called monocryl or polydioxanone. These two material have high memory. Means after opening the packet, if you try to make them straight, they will again become squared. This is their inherent property. Then nylon Nylon has moderate memory. And if you open the packet of a Vicryl, it will become straight. Vicryl is best suture material. It has good flexibility. Uh, it is having less memory. It is having less memory. So there are three materials I have given example: monocryl, polydioxanone, high memory; nylon, moderate; vicryl, less memory. So for a suture material to select, it should have least or less memory. Then the next characteristic is tissue drag. Drag means friction. Drag means friction. This is the friction between surface of suture material and your tissue. For example, this is the multifilament. The surface of the multifilament suture is rough, and the surface of the monofilament is smooth. Suppose you are doing a delicate surgery of the eye, delicate structure eye, like cherry eye operation or any entropion, ectropion. So if you are doing a surgery on the eye, you want smooth surface material, suture material. Why? Because in eye, if you use a rough surface material, then because of the friction between the suture material and the layer of the eye, it may cause tear of the tissue, it may damage the tissue. So multifilament suture material have rough surface and they have more tissue drag. They have more friction. When they cross the tissue, they cause more friction and they may damage the tissue. So we have some planning, some ways to reduce this roughness. So to make them smooth, we do coating. There are some materials called calcium stearate. This material is coated on the surface of Vicryl, because multifilament example is Vicryl. So Vicryl suture materials, they come in the market with coated form. Calcium stearate is the molecule which do the coating of the Vicryl and make it soft. So now the surface of the Vicryl become smooth and soft because of the coating. So to reduce this tissue drag, to reduce this friction, we do coating of our material. Because multifilament suture materials have some good properties also. Last is knot security. This is the wound edges. Suppose we are applying simple interrupted pattern. So at the end we apply knot. Or suppose we have started simple continuous and here we apply a knot. So for a suture material, knot security is also important. If you want to learn one example, that is your silk. Silk has very poor knot security. If you apply a knot in the laboratory, if you are doing knot practice in your laboratory, practicals, then if you apply a knot to the silk material, it will automatically open simply by a small force. If you apply a small force, it will open. So the knot security of the silk material is very poor. And knot security of nylon is also not good. So which is the material having good or you can say moderate not excellent, but moderate knot security. That is your Vicryl. That is your Vicryl. So Vicryl is having better knot security. So if we define what is knot security, so this is defined. Knot security is nothing but a feature of friction between adjacent strands of suture in a knot. It means in case of multifilament, there are multiple filaments, and in between these filaments there is friction. So it is a friction between these strands. It is a friction between these strands which define the knot security. It means a single monofilament is having less knot security as compared to multifilament, because knot security is a feature of friction between multiple strands. These are multiple strands of your vicryl, and this is a monofilament your nylon. So out of these two, which is having better knot security, that is your vicryl. Poor knot security, monofilament, because knot security is a feature of the friction between these fibers. So these fibers, they are providing a better knot security. And silk is having very poor knot security. The last characteristic of suture material, number 10, is the reactivity. Our suture material should be non-reactive. It should not react with the tissues of our body. But exceptionally, there are two examples, and both are of natural origin. One is silk and one is your catgut. These both material, silk and your catgut, they cause high tissue reactivity, high tissue reaction. But in case of catgut, we have one option to reduce this reactivity. How we can reduce the reactivity? We add chromium salt. We add chromium salt. So by adding chromium salt, the reactivity of catgut may decrease to somewhat proportion. But silk is the highly reactive suture material. So our suture material must be non-reactive. But silk is the highly reactive, and catgut is also reactive, but to reduce its reactivity, we add chromium salt, and the process is called tanning. Addition of chromium salt to reduce its reactivity and to increase its half-life. That is, so silk highest catgut, we should call it chromic catgut. Less, and there is one material, polypropylene, which is come in the market by the brand name Proline. It is having least reactivity. It is having least reactivity. Because of least reactivity, this proline or propylene is a suture material of choice for your cardiovascular surgery. So silk highly reactive, chromic catgut less than silk, and polypropylene or proline is the least reactive and good choice of suture material for cardiovascular surgery. So If we summarize the properties, first was size, second was absorbability, which define there are some observables, there are some non-observable. Size was 12, 0 to 7. 12, 0 to 7. And the third property, it was tensile strength. Tensile strength. Fourth was functional strength, that is nothing but the tensile strength in vivo. And number fifth was your structure, that may be monofilament or that may be your multifilament. Number six characteristic property was capillary. The material should be non-capillary, and for this multifilament were having more capillarity as compared to mono. And number seven property was memory. In this we have seen that Vicryl is having less memory than your nylon. And number 8 property was drag, that is friction, and this friction is more in case of multifilament as compared to monofilament. And number 9 property was not security, and number 10 is your non-reactivity. So these are some of the characteristics, some of the qualities a suture material should have. Other than this, you may find in books 4 to 5 more properties like flexibility and all, but these are the more important ones, where size, absorbability, tensile strength, functional strength, structure, capillary, memory, drag, node security, and non-reactivity. Then there is one small topic, suture holding power. Suture holding power. This is the power of tissues. Fascia is having maximum suture holding capacity. If we compare with the fat is having least or minimum. And if we look at the muscles are also having poor suture holding power. But in case of muscles, there is one important concept. These are the muscle fibers. If you apply your suture material parallel to the fiber, it may pull out easily. Second thing, if you apply your suture material across the fiber, perpendicular to fiber, it will be having better suture holding power. So across the muscle fiber is better than parallel the muscle fiber. So with regarding to muscles, remember across like perpendicular is better than the parallel, because parallel may easily pull out. After suture characteristic, there is one important topic, that is classification. That is classification of suture material. This classification is based on number 1, absorbability. Based on this, there are two types of suture material. One is absorbable, other is non-absorbable. Second is origin. Based on origin, there may be three. That may be natural. Some books call it organic. Second is synthetic, and third is metallic. Metallic, we mostly use stainless steel wire. Stainless steel wire in orthopedic wiring, like fracture of your lower jaw, mandible, like. And the third base is the structure. Based on structure, we have two classification: mono or multi-filament. Multi. So this is the classification which is given in many books. Suture material are classified based on absorbability. They may be absorbable or they may be non-absorbable. Absorbable means absorb, breakdown within 60 days, or non-absorbable means more than 60 days. Origin may be natural, synthetic, metallic, or based on structure may be one filament or multi. So first we'll look at the first classification, that is absorbable or non-absorbable suture materials. So first is absorbable and the second is non-absorbable. This classification is further divided into number one, natural. This is also natural. And number two is your synthetic. Number two, here also synthetic. So what are the natural fibers? First is your catgut. Catgut is nothing but 90% collagen. 90% collagen. And second is your collagen itself. Collagen. And third is kangaroo tendon. This is also collagen. So the first three are nothing but the collagen, and the fourth one is fascia lata, which is a fascia of thigh muscles of bovine, and last is your Cargill membrane, and it is derived from the cecum of bovine. So these are the natural ones. Out of these, catgut is most commonly used. This side, the non-absorbable, we have silk, we have cotton, we have linen. This is a superior quality. This is superior quality cotton. It is also a cotton. So first is silk, cotton, linen, and the last is your horse hair. Horse hair. Out of these four, silk is most commonly used. If you look at the synthetic, absorbable synthetic, they are your vicryl, they are monocryl, they are your Dexon, and they are your PDS, polydioxin. And this side we have umbilical tape. Umbilical tape. This tape is nothing but it is made up of cotton. That is important. Umbilical tape is not derived from umbilicus. It is not derived from the umbilical cord. It is synthesized from cotton. But the use is, this tape is used to tie the umbilical cord in a newly born calf. So it is made up of cotton. Next, here non-absorbable nylon. Next, proline and merino. So these are absorbable and non-absorbable, divided into natural, synthetic, natural and synthetic. And the second is your based on structure, monofilament versus multifilament. In case of monofilament, the first difference is the number of strands. Mono means one strand and there are multiple. Okay. Second is flexibility. Flexibility. It is having low flexibility. It is having high flexibility. Next is crevices, spaces. These are absent, crevices are present because these are multi-filament. So in between filament, these are the spaces where bacteria may enter. So the next is surface. Because it is monofilament, so surface will be smooth, and it is multi, so surface will be rough. Drag. See, smooth fiber can easily cross to any tissue, so the drag will be low, and this is rough, so the friction will be high. Next is bacterial contamination. Because this is smooth fiber, low capillary action, so it may be absent or low, but there is moderate to high. Moderate to high. So these are some of the example difference between mono and multi-filament. From this mono multi-filament, there was one MCQ asked in your ICAR 2002 that mono or multi. Monofilament may be absorbable or non-absorbable. Similarly, multifilament may be absorbable and non-absorbable. The MCQ asked was polydioxanol. Suture material is. Answer was monofilament absorbable. The second example is monocryl. Monocryl. And in case of monofilament non-absorbable, we have nylon. We have horse hair. In case of multifilament absorbable, the commonly used material, your catgut and your vicryl. And in case of non, that is your silk. That is your silk. And one more is Vitafil. Vitafil was used previously to close the hernial defect, hernia closure. But because of some superior materials, these days we are not using Vitafil. So previously it was used in hernia repair, but Vitafil is not used nowadays because of availability of some superior suture material. So with this classification, now we'll start with some individual suture materials. The most commonly used suture material in your veterinary surgery is your catgut. Catgut. There are some important points about the catgut. Catgut is not obtained from the gut of the cat, it is obtained from the gut of the cattle or sheep. Both are ruminant. From cattle, it is obtained from the serosa, and sheep, it is obtained from the submucosa. These both are the part of intestine. Second thing, what is catgut? It is nothing but 90% collagen. It is 90% collagen material. That is collagen. And the more important about catgut is the classification type. It is natural, it is multi-filament, and multi-filament type twisted, and okay, and it is absorbable. It is absorbable. See, if it is absorbable, then what is the mechanism of absorption? That is your phagocytosis. Phagocytosis, that is your enzymatic digestion. One more important point in your Venugopalan, it is given that about sterilization. About sterilization. See, in that book they have given there are two types, boiling type and non-boiling type. Boiling type you can boil. Boil means what? You can go for autoclave. But these material are more stiff and these are not available in the market or these are not used nowadays. What they are using is non-boiling type. So if in MCQ, if they ask that what is the mechanism for, simply if they write what is the mechanism for catgut sterilization, catgut sterilization, your answer should be gamma radiation. Gamma radiation. It is not sterilized by the autoclave. Not sterilized by the autoclave. Why? Because autoclave will denaturate it. It will cause denaturation. What will happen? The strength will decrease, material strength will decrease. So gamma radiation is costly. In some books they may give you ethylene oxide or somewhere other component also given. But mostly gamma radiation. If it is not given in the option, answer will be ethylene oxide. But for catguts, never go for autoclave. It will cause the denaturation that may reduce the strength. If you open, see, packaging. This is the packet of the catgut. If you open the packet of the catgut, you will find some liquid will come out. Some liquid may come out. That liquid is nothing but your 85% alcohol. And that is nothing but used as a preservative. So if you open the catgut suture material, there will be like this, suture material and the needle. This is the needle and this is your suture material. Okay, and here you will find some liquid, and that liquid is nothing but 85% alcohol. They say it is used as a preservative. Why it is used as a preservative? If minimum alcohol used is 85%. If what will happen if you use 40%, 60%, 70%, 75%? See, these percent of alcohol, they contain more water. They contain more water. And water causes hydrolysis of catgut. The mechanism of breakdown of catgut is mainly enzymatic, that is phagocytosis, but small amount, or you can say 30-40% is also breakdown by the hydrolysis. So the water, if you put your catgut into 40% alcohol, means it is having 60% water. That water may cause dissolution, hydrolysis of the catgut, that may reduce the strength of the material. So the minimum recommended alcohol is 85. Maximum may be 99, 99.5%. Above 85, you can take 90%, 91, 92, but the minimum should be 85%. So this is the packaging of your catgut in alcohol. Next is classification of catgut. See, catgut may be available in different type A, B, C, and D. A catgut is plain. It may be absorbed within 3 to 7 days. And these three are product of chromium salt processing. So we call it mild chromic. It is called medium chromic, and last is called extra chromic. 3 to 7 days, 10, 20, 40, you can say in books. Within these days it may be absorbed. But the more important is this type C. Type C, the name itself, that type C is the commonly used catgut. Type C. So based on chromium salt treatment, it is divided into. So what is the significance or advantage of using this chromic salt? First is why we are using chromium salt. Why we are using chromicized catgut? It will reduce the reactivity. Means our suture material will become less reactive for the tissues. Second is increase the strength. It will plain catgut may dissolve within 7 days, but the other are within 20 days, maybe 40 days. So it may increase the strength. So it may reduce the tissue reactivity, or it may increase the strength. Means it decrease the absorption time. So for it will remain in tissues for more time. Next is availability in market. As I told you that catgut is available with 80% alcohol. That may be ethyl alcohol or isopropyl alcohol. Second is catgut is available in market from 70 to 7. These are the numbers. If you look at the use in small animal versus large animal. So in case of small animal, we use 10, 20, starting from the, suppose we start from inside, peritoneum. Then come outside, muscles. So we use 10, 20 for peritoneum, for intestine. Outside peritoneum is the bowel. And 1 or 2, these are for your muscles and for your fascia or subcutaneous tissue. In case of large animal surgery, number 5 is used for rumen, uterus or abdomen. That is very important. Catgut number 5. And catgut number 3 we use for the muscle and for the fascia. See, in both cases, from inside to outside, we have covered peritoneum, intestine, muscles, fascia, like rumen, uterus, abdomen, muscles, fascia. But in these cases, skin is not written. In either cases, why they have not written skin? Because in case of skin, we never use catgut. For skin, what we use? Nylon. That is the non-absorbable material. So for skin, we use nylon. So not catgut. After catgut, the most commonly used absorbable is your Vicryl. Vicryl is the trade name. The generic name is polyglactin 910. Poly means multiple and G for glycolic acid and lactin means lactic acid. Lactic acid. These two molecules, they are combined in 9:1 ratio. And this Vicryl molecule is your multifilament. It is multifilament. It is braided. It is absorbable. And it is synthetic. Synthetic. These are the properties of your Vicryl. It is synthetic and it is absorbable. It means the mechanism of absorption will be hydrolysis, because synthetic are degraded only by water molecule. The water molecule break down the covalent bond and the process is called hydrolysis. So Vicryl is absorbed by the body by hydrolysis only. Because Vicryl is multifilament, so there may be more capillary actions, more tissue drag, but in case of Vicryl, this multifilament is coated by calcium stearate that make it surface smooth. Make it surface smooth. From with this Vicryl, there was one MCQ asked in NET exam 2021, that which is not true for Vicryl. 4 options were there. First is, it is degraded by hydrolysis. Second was, it can be used in infected, contaminated bladder surgery, and it is rapidly degraded in alkaline environment. Rapidly degraded in alkaline environment. And last was rapidly degraded in infected urine. So it is synthetic absorbable. So this is true. Degraded by hydrolysis. It is rapidly degraded in alkaline environment. This is true. And rapidly degraded in infected urine. This is also true. So if it is degraded in infected urine, so we cannot use this suture material in infected bladder surgery. So this was the false. Then there are two materials. One is monocryl and one is polydioxanone. Both are in this case, it is known for its rapid absorption, and this is known for late absorption. So we can use the monocryl, which is nothing but a monofilament, and this is also monofilament. Rapid absorption, so we can use this filament for those tissues which heal rapidly, like mucosa, any mucous membrane, because mucosa is always having better blood supply, they heal faster, so we can use this material. We can use for bladder, because bladder is also rapidly healing tissue. So at these two places we can use those suture material which are having rapid absorption. But this monocryl we cannot use for tendon, we cannot use for fascia, because these are slow healing tissue, or linea alba also, linea alba. These are slow healing tissue. So for these, we have one more option, polydioxanone. Delay absorption. So we can use this material for tendon, for fascia, for linea alba. Because linea alba, tendon, they have less blood supply. So the healing will be less. So they want that material which is having late absorption in that tissue. So for rapid absorption we have monocryl, and for late absorption we have one suture material that is called polydioxanone. And in market it is available by the name of PDS2. So remember these two monofilament suture material, and both are absorbable. The next suture material, see, in absorbable we studied catgut, we studied vicryl, we studied monocryl, and number 4 polydioxanone PDS2. These two were multifilament and these two were monofilament. This monocryl, this was used for rapid healing tissues, and this was using for delay healing like tendon, fascia. So these four were absorbable. These two multifilament, these two monofilament. Then we come with one more class, that is your non-absorbable. There is one that is called silk. Silk is multifilament. Multifilament. Silk is natural. Silk is having more tissue reactivity, because this is obtained from the natural origin. So it is a multifilament, non-absorbable and natural. And one more thing I told you about this, very poor knot security. If you apply the knot, it will open. So more tissue reactivity, very poor knot security, multifilament nature, and silk is contraindicated in contaminated wound, yeah, contaminated surgeries. So in contaminated surgery, we can use our material vicryl, that is polygalactin 910. The next material is your proline. Next material is proline. So proline is the trade name. The exact molecule is polypropylene. Color of this suture material is blue. So we can say this is dyed molecule. The dye is applied on the molecule, and this dye is blue color. Why it is colorful? Because proline we are using for the blood vessels. Blood vessels. Blood vessels are having blood. If the material is having brown or red color, then it may be look like that color only. So for better visualization, for better visualization, we apply blue color so that we can say it can be seen easily in the vessels as a blue color. The more important 2 points for proline, at least 3 points for proline. First is blue color. Second is least reactive for the tissues. And third is suture of choice for cardiovascular surgery. Cardiovascular surgery. Why cardiovascular surgeries? Because it is non-thrombogenic. It will not form any thrombus. And it is least tissue reactive. And last non-absorbable suture material is our nylon. That is nothing but your polyamide. It is available in two forms, monofilament or multifilament. But mono is more commonly used. Mono is more commonly used. Nylon is used for the skin, for skin closure. And this nylon in our clinics, it is available in black color. It is available in black color. In books, it is also given that it is available in green color also. But here we are using black color nylon. So black color, that is, it is also dyed. There are two MCQ. If they ask most commonly used absorbable natural suture material, answer will be catgut. Most commonly used non-absorbable natural one, answer will be silk. If they simply ask most commonly used suture material in wet surgery, then answer will be your catgut, what we call chromic catgut or simply catgut. So we have seen suture material. Then these suture materials, they are used with the help of needle. There are two types of needle. One is that we commonly use at our home also, and that is called as EYE, eyed needle. And another one is, suppose this is needle, and here also. This is called swag needle. In this needle, the suture material, this is the suture material, it is already fixed to the needle. It means this suture needle with suture material, it is already fixed, this is swagged, and we cannot reuse. We cannot reuse. This is, you can say, single use only. Single use only. But eyed needle, it is having one hole that is available at our home. Our mothers use for clothes. So what we do, we keep suture material like this. It can be reused. It can be reused. But problem with this eyed needle is if you use it repeatedly, then it may become blunt. It may become blunt. So eyed or swag needle are there. One is already come with the fixed suture material. One in second is one where we keep the suture material like this. These needles, if we look at their body and their tip, these are of two types. One is round body. So round body needles we commonly use for internal organs. For example, uterus, stomach, intestine, and muscles, and fascia, subcutaneous tissue. So these are soft tissues. These are soft tissues. For them, we use round body needle. But those tissues which are tough, which are dense, for them we use cutting needle. Cutting needle. So cutting needles are used for skin. Because if you use round needle for the skin, what will happen? They will break or they may bend. So for skin, we use cutting needles. They will cut the skin and we can suture easily. So in this lecture, we have covered suture material characteristics, then suture material itself, their classification, then types of needle, how they are available. So in next lecture, we'll cover suture pattern and knots like square knot, surgical knots, and remove.